Hello and welcome to the Dissect and Connect podcast. I'm your host, Mike Wade. This is the podcast where we explore population health issues impacting your community. Dissect and Connect is a service of New River Valley Community Services and the Montgomery County Prevention Partners. Dr. Brandy Faulkner is the Gloria D. Professor of Africana Studies in the Department of Political Science at Virginia Tech. Her teaching and research focuses on race and public policy and U.S. constitutional law. She's a multi-award-winning faculty member and is also recipient of the prestigious Valvoline National Caring Hands Award, given to community leaders across the country who are engaged in exemplary youth development. Dr. Faulkner is an organizer focusing on racial and economic justice. She is committed to cultivating community-based approaches to problem solving and serves several state and national organizations dedicated to social, political, and economic change. She has worked with both institutions and individuals engaged in direct action organizing, advocacy, and public policy development. So, Brandy, welcome to the Dissect and Connect podcast.
Thank you for having me.
Yeah, we're glad to have you with us. We're here to talk about a different topic, obviously, but I mentioned in the introduction that you are a professor of Black Studies at Virginia Tech. And I just think I would be remiss if I didn't give you an opportunity to weigh in on our current events. So wanted to get your thoughts.
Yeah, I think we're in some interesting times, some unfortunate times, but also a time in which we can reflect, think about all of the things that are happening around us, and figure out how to move forward. We have been dealing with problems of racism, institutionalized racism for our country's existence. And so with the attention that is now being drawn to that issue specifically, with looking at institutions like policing, institutions like our criminal justice system, institutions like our educational systems, we have an opportunity to really make some progress and to move forward. So I am very, very hopeful about that.
We're going to talk today about poverty, class, and socioeconomic status. Poverty, a huge social determinant of health, and it's at the crossroads of so many other determinants of our health and well-being. Poverty itself is a word that, at least for me, is hard to say, hard to hear sometimes. But I think it's important that we have a better understanding of it. Why do you feel it's important for us to recognize and understand poverty?
I guess quite simply because people are suffering. And when we think about the number of people who are living in poverty and the effect that it has on their quality of life chances. And I think you made a great point. It's very hard to talk about poverty in the United States because it's supposed to be a country of positive superlatives, right? Exceptionalism, the best at everything. It's seen by so many as the land of opportunity, even. And so this bootstraps mentality that we tend to have, that anybody can make it, all you have to do is work hard, pull yourself up by the bootstraps, and you too can be the next Bill Gates. It's very difficult to deconstruct that. And so if things aren't going well, you have to find some way to explain it. And unfortunately, we have ignored many of the systemic causes of poverty, and have instead place the blame at the level of the individual. It's an individual failure. And in worst case scenarios, it becomes tied to a moral judgment. So he's poor because he didn't work hard enough. She made bad choices. They didn't do well enough in school, things along those lines. He just doesn't know how to manage his money. And then on top of that, what we tend to do is condemn poor people for getting help, right? she shouldn't be on welfare. She's a lazy welfare queen, and she's taking advantage of the system. Those kinds of things, right? So the message is very clear. If you're poor, it's your own fault. You did something wrong, and so you deserve whatever consequences follow. And so we look down on poor people, and poor people get the hint, right, fairly quickly. You
Right.
better stay hidden. You'd better not demand better. Just keep your head down, work hard, and hope for the best. So that creates an incredibly difficult dynamic to navigate when we're trying to not only support those who are in poverty, but also come up with ways to create fairer and more just systems so that we can eliminate poverty. It's an incredible dynamic to think about and navigate.
It's a huge topic with lots of different factors and outcomes that are possible. And you mentioned the systemic issues, and obviously that bar that we have set as a society around the federal poverty guidelines. And just in preparing for our conversation today, I, out of curiosity, looked up what the current federal poverty guidelines are for a family of four, and that is an annual income of $26,200, which, if you break it down, that's $2,183.33 per month for a family of four. And it's gone up just about $4,000 since 2010. So in the past 10 years, that really hasn't changed significantly. But that guideline is such a metric for so many of our resources, so many of our programs. And when you think about the math on that, it doesn't really add up to live any kind of quality life.
And even just to think about the reality of poverty, to use income and household size as the basis for determining whether someone is actually in poverty, we already know that that's sufficient. Right? So then you have people who say, all right, well, maybe we won't use this baseline of income of people in the household. We'll look at things like level of employment, right? Or people unemployed, or they underemployed. How about we use things like twice the federal poverty level, right?
Right.
And even if you use that, we've got almost 30% of the nation at twice the federal poverty level, right? So they're still living on about $51,000 for a family of four at twice the federal poverty level. So it's incredible to think about that, but certainly income and size of the family union isn't sufficient to really understand the nature of poverty in this country.
Well, when you begin to talk about matters related to class and socioeconomic status, and and you've already touched upon it at some level with just the stereotypes, the stigma, the negative labels that get dumped upon people depending on which class or socioeconomic status level they belong to. Even that itself can have significant detrimental impacts to an individual or family, correct?
For sure, for sure. And thinking about class and classism, right, it's often framed as haves versus the have-nots.
Mm-hmm.
And when we do that, then it's easy for us to start talking about things like those who are less fortunate, those who don't have. Well, have what?
Right.
Exactly? Class and classism are about the ways in which economic values are reinforced, right, through public policy processes. So it's not just about those who have money and those who don't have money. We are talking about incredible effects on individuals' self-esteem, right? Their access to opportunities, whose family has connections, whose child gets to go to summer camp, what college or university you get to attend, if at all, right? Who has access to doctors and healthcare professionals, and under what circumstances do they have them? So this whole idea of class is so much bigger, I think, than we tend to talk about it in. And we're talking about large groups, right? Large groups of people who occupy similar social, political, and economic positions in society. So we have to think about it, I think, on a deeper level and not just frame it as this dichotomy of those who have versus those who do not have.
And it seems from the research, everything that's out there, is that gap between the haves and the have-nots is increasingly widening and getting larger all the time. Can you speak to some of the causation around that?
We can look at some of the systemic issues, right? We know that there are entire regions of the country that are economically isolated, right? And that most certainly contributes to wealth gaps. We know that institutional practices like racism and sexism play a huge part in class mobility, low wages and worker exploitation that also contributes to widening gaps. And these are things that are reinforced through public policies,
Mm-hmm.
right? When we look at things like collective bargaining agreements, right to work laws, minimum wage laws, and the fight that we're currently having across states about what would be an appropriate living wage, right? So all of those kinds of things that determine whether an individual will thrive or not have to be considered when we're thinking about widening gaps. And the truth is, we have a lot of resource hoarding, right? Those
Mm-hmm.
who tend to have access and control over resources don't want to give that up, and like to control the terms in which those are even shared. So that significantly contributes to the gap that you're talking about.
You touched upon geography, and I've seen several reports that talk about the impact of just your zip code on your
Mm.
overall life expectancy. I mean, that's significant. Can you talk about that a little bit?
Yeah, absolutely. We know that poverty um, is not distributed equally across populations, and geography plays a major role in assessing poverty. When you look at things like the American Community Survey that the Census Bureau does, we know, for example, that rural poverty, which is largely concentrated in the South, is significantly higher um, than it is in other places, right? We're talking about what most experts consider to be severe poverty, right? Where you've got about a quarter of children, about 6 million children in these rural areas who are growing up in poverty. Appalachian communities have some of the highest rates in the country. And so it's incredible to think about that. So absolutely, zip code, that geographic isolation, pockets of people who, for the most part, are hidden. Um, how can they be suffering so and nobody really talking about it at any significant level? It's very important that we do bring that up and understand that it is different. It
Mm-hmm.
is a different experience.
Can you talk about the long term impacts of children who grow up in poverty?
Yeah, so there are a lot of factors that we have to consider. For me, one of the most important factors to consider is the psychological aspect of that, right? Think about growing up through your entire childhood into adulthood, thinking that you don't deserve, right? That you are not good enough, that your family's income determines your value in life. It determines how people view you, whether they even think you are worth a conversation
Mm-hmm.
in some instances. And think about the psychological toll that takes on a child. It's really heartbreaking to think about it. And then how that limits access to opportunities as well. Growing up in poverty, we know that educational opportunities are affected by that. Um, Number of teachers in the classroom, quality of teachers in the classroom, and they too bring biases, right? So they can perpetuate a lot of stereotypes. They treat students differently in some instances. So this whole system gets reinforced. And then knowing that even if you're working hard, even if you're smart, so many doors will be closed to you because of your situation. So we make all of these prescriptions, right? We say, continue to work hard, get good grades, you'll get into a great college, and you'll be on your way, right? You're going to lift yourself up out of poverty. And then students say, okay, I'll do that, right? And they do exactly what is prescribed. And then, they find out, well, I don't have the money to go to college. It doesn't matter that I got the grades. It doesn't matter that I worked hard. I can't afford to be in a college or university, even despite scholarships often, right? So it's incredible really to think about that. And then we look at things like health, right? Even just accessing nutritional food.
Absolutely.
For someone living in poverty, we have food deserts, and that is not just a physical thing, right? Certainly, we know the physical effects of lack of nutrition, but again, it's that social and psychological reinforcement. I can't even access the right foods.
Mm-hmm.
I am stuck having to eat this while everybody else is over here enjoying some fresh foods and foods that are good for them. So there are so many layers to this, and we have to think about it holistically.
And a lot of what you've just talked about, Brandy, really feeds into that vicious cycle of poverty that so many people find difficult to break out of. I mean, that's really a mainstay for so many of our communities.
Yeah, when we look at the rates of generational poverty, um, and again, the idea that we can just break it, right?
Yeah.
No, it doesn't work that way. And the cycles are definitely perpetuated institutionally. And so it is true that if you have grown up in poverty, you are likely to stay there. Um, of course, we do have some examples where that has not happened, but more often than not, the cycle will be perpetuated, and it's through no fault of the individual. This is systemic perpetuation. Yes, that's a great point to mention.
So, with the impact of the COVID-19 pandemic, we're hearing and seeing that a lot of data is showing that people of color, indigenous people, are more susceptible to the impact of this particular pandemic. Uh, Not so much about the color of their skin, obviously, but their access to healthcare, access to resources. That all plays a factor in that. Can you talk a little bit about what we're seeing with COVID-19 and how that is impacting folks who live in poverty?
Yes, and there are a couple of things I think are important to bring out when we see disproportionately the number of Black and Brown folks who are suffering under COVID. We immediately start to look for individual factors that could be contributing, right? Personal things that we can attribute to these communities, so that we don't really have to examine the systemic failures.
Mm-hmm.
And one of the things that we saw early, of course, was lack of access to testing, but also because of the relationship between these communities and the medical community, we had a lot of people who didn't want to be tested, who
Yeah.
did not trust the system. And what would happen even during a relatively simple testing process. And we have to think about those things. What is the relationship between these communities and medical professionals who are supposed to be helping? But we also know that quality of life indicators, when we're looking at things like disease, are disproportionately going to affect communities of color. We are getting better across the country with access to testing. It's a slow process, to be sure, but there is greater access. What we don't know, though, are the rates in which those who are most significantly affected are getting tested. Right? So there are some disparities there that we still have yet to understand. And of course, if we don't understand them, then we can't correct them. But then also, what about resources? Resource distribution plays a huge role in COVID. And I was talking with some community members just a couple of weeks ago, and many of them didn't have access to basic information, for example, about how to get a test in the area, whether or not they could go get a test even if they didn't have the money to pay for it, right? These are the things that come up consistently. And to have someone ask you that question, right? To tell you, I don't feel the best. I don't know if it's COVID, but here are some things that I'm feeling, but I don't want to try to get a test. I can't afford it. And it just sort of hits you that this is a major problem, right? How many people are sitting at home thinking, can't afford a test, which means I can't get one, which means whatever I have it, and there's nothing I can do about it. Think about that. I mean, it's just mind-boggling. But they're used to being in that situation where when they feel ill, when they're sick, they think, well, I'd better do my best to try to take care of it here because I can't afford any other option. And so we should not be surprised with any of the disparities that we're seeing based on race and ethnicity. Specifically, we have a long and terrible history when we look at those communities and how our healthcare system consistently fails them.
Yeah, just add COVID-19 to the list, right? I mean, it's nothing new.
Absolutely.
So, to go back to the core issue around poverty, how do we improve the situation? Or can we improve the situation?
I'll start with your second question. The answer is yes.
Good.
We absolutely can improve the situation. Now, beyond that, things are going to get a little iffy, right? Because, when we think about how there have been so many policy proposals, what we have yet to do, though, I think, is to understand poverty holistically. Come up with a holistic plan to address the multiple layers of this situation, and then sustain those efforts over time. That's necessary if you're going to combat a multifaceted condition like poverty. And what our public policies have done over time is attack it piecemeal, right?
Right.
So we, as I mentioned earlier, identify something like, education is a solution to poverty. Okay, so let's just make sure that people are getting educated, right? All right, but what about the myriad issues connected to just education that we are failing to address? It's not just a matter of making more scholarships available, right? It's not just a matter of changing educational standards. There is so much more to it. And so I think what we have to do is make sure that we are understanding poverty holistically and then coming up with public policies that reflect that holism. And then you get into this very interesting conundrum where we will actually conclude that we don't have enough money to help poor people.
Yeah.
And that alone is just mind-boggling to me. We're too poor to help poor people. And we know that that's not true, right? It's a matter of priorities. It's a matter of where we allocate resources. It's a matter of being able to look at systems and identify opportunities for change. And most importantly, we have to want to change it. And we know that poverty, like many other social and economic problems, um, are perpetuated largely because it's to someone's benefit, right? It's not just that we have poor people and that's the end of it. No, there are people who benefit from keeping other people poor. So how do we fundamentally shift power in such a way that those who are directly affected by conditions of poverty have greater opportunities for participation in our system to create change? And until that fundamental shift happens, what we will continue to see is a group of power brokers who say, well, we know what's best. We're going to make some decisions and you'll see it's going to be all right. No, it's not all right. It has never been all right. And so we have to think about it differently. But there is absolutely no doubt in my mind we can fix this situation. We absolutely can. We just need a better plan for doing so.
Granted, the current political climate and the partisanship that exists sure seems to make that all the more difficult. Wouldn't you agree?
So when we look at things that are taking the greatest hit right now, we know that safety net programs are a target, right? And we have evidence that safety net programs do help to improve the quality of life among poor people. So when you look at things like SNAP benefits, right? Nutrition programs, things like earned income tax credits, things like educational Head Start programs, we know that these things do improve the quality of life for those who are in poverty. And they are also the target for cuts, right? So when you take away what for some can be the last little bit of hope, how can we expect to make any progress? And so in our current political climate, those types of programs are being discussed for elimination, right? Or at the very least, some very severe and drastic cuts. So what are we to do, right? What about those families who rely on SNAP to get their basic nutritional needs met? If you say to them, well, now you're not even going to have access to that, what do we really think will be the outcome? People have to eat. That's not an option.
Right.
It's not a luxury. And we sometimes will look at these programs and talk about them in terms of them being some sort of luxury. No, access to food isn't a luxury. It's a necessity. So I think you're absolutely right. And of course, the very real budget cuts make things difficult, but also we go back to reinforcing that rhetoric. You're not deserving. When we make those types of cuts, what we're saying to poor people, you don't deserve to live. And so we're going to cut you off from your very means of existence in many instances. And I think that's very sad.
There are people, out there, even some listening to this podcast, that aren't going to want to hear that. They're not going to want to hear it put in those terms, but that's the bottom line. I mean, that's really where it lands, is that it's essential to the very existence of a lot of individuals and families out there that just can't make it without this. So how do you cut those programs that are so vital?
But again, these things are learned. Okay, so we have to do better with how we discuss these types of programs and the opportunities that they can bring. And we have to frame them in such a way that They don't assign value judgment to people, right? And we also have to stop playing the zero-sum game, right? So even if I don't have a whole lot, I really believe that I worked hard and I earned everything that I have. And so when I look at someone who is receiving benefits or assistance, my mind tells me, well, why do they get it?
Right.
Why can't they just work hard like I did? Um, what is it about them? Right? We start othering.
Yep.
Right? Instead of seeing ourselves as part of a whole. Right? That's my neighbor. That's my friend. That's my community member. And I'm going to do whatever it takes to make sure that they're okay. Right? I just wish we saw more of that attitude when it comes to poverty, not the immediate judgment that we assign, not the contempt, not the disdain, but just basic care. I care about this person and their life chances and their circumstances. And if assistance programs are what help them to get through right now, I'm okay with that. I'm okay with it. And not only am I okay with it, I support it. They should have it. But we're talking about so many decades of trying to undo the damage that has been done psychologically when we discuss this. And, I was thinking the other day just about Southwest Virginia and the scheme of all of this, right?
Mhm.
We are, unfortunately, one of the areas with a high poverty rate, right? 24%.
Right.
24% in Southwest Virginia. It blows my mind to think about that. And even higher percentage of people who are what we call ALICE or access limited, income constrained, but employed, right? So we're not talking about people who we like to brand as lazy and not working. No, we're talking about people who get up every day, work some of the most humiliating menial jobs for subpar wages, and they work hard and they still can't make ends meet.
Yeah.
We have to think about those types of systemic problems.
There's so much we could go into with this conversation. Do you have any suggested resources for our listeners, Brandy, around this topic? Books or maybe websites that you might refer folks to that want to learn more?
Yeah, we've got some, I think, rather incredible resources. If you're a data person, right? If you just want to see what the numbers look like and how trends have been changing over time, then I certainly recommend that you take a look at the data from the U.S. Census Bureau. They have some incredible reports there as well. You can look at organizations like the United Way. If you're trying to understand your local dynamics and what's available there and how the local community looks, that's certainly a resource as well. You can take a look at things like the Southern Poverty Law Center if you're trying to understand some of that dynamic. It's a very helpful site as well. So we do have quite a few resources that we can tap into to understand not just what things look like, but also what is actually being done. Right? So you can tap into organizations that you can support, right, and contribute to. We have direct action organizations who have been working in this area for a long time. Organizations like Virginia Organizing, for example, that actually goes out and talks to people in the community to find out what their life is like, what resources they need, brings people together to figure out how we can help to change public policies and power dynamics. So those are just a few resources that I would highly recommend.
Wow, going out and talking to the people who were actually affected by this. What a novel approach.
It's something that seems so simple because it is.
Mm-hmm.
But it takes us away from, the father knows best mentality, right? This very patriarchal way of trying to understand and solve problems of poverty. How about we center those who are directly affected, hear their voices and their solutions? They know what they need. They know. They experience it every day. So, yes, we have to go out there and have the conversations with those who are directly affected.
That and the basic care and compassion that you mentioned earlier. I mean, I think both of those go a long way.
The care and the compassion, that's a starting point, right? That gives us our base of operations, but it's not enough. We have to act. We have to be active. We have to be proactive in coming up with solutions, and we have to work hard to be sure that those solutions are implemented.
Well, I think that's a great way to wrap up our conversation for right now. Thank you again so much for taking time to be a part of this discussion and to get our minds to start thinking about some ways to address this problem in our society.
Absolutely.
Yeah.
Absolutely. And thank you so much for the work that you do in the community to help and to support those who are in poverty.
Well, I would love to have you back on the show at some point in the future to talk about this some more, to dig a little deeper. I think we've just scratched the surface today. There's a lot more we can talk about. So look forward to having you back on at some point in the future.
Absolutely, anytime.
Dissect and Connect is sponsored by Teen Connections, a leadership program through Planned Parenthood South Atlantic that empowers youth with the facts about sexual health and the skills to build stronger, healthier relationships. It's free, totally virtual, and you can earn $100 when you graduate as a Teen Connections peer educator in your community. Join a Teen Connections program from home today. For more information, be sure to check out the show notes from today's episode. We hope you've enjoyed this episode of the Dissect and Connect podcast. To learn more about Montgomery County Prevention Partners or New River Valley Community Services, be sure to check us out on Facebook or visit nrvcs.org/podcast.